The question is, what can cause infertility in a couple? Infertility, 1/3 of the times is related to the woman, 1/3 related to the men, and 1/3 of the time we don't know what actually causes infertility. In men, usually it's a low sperm count or lack of sperm that can cause infertility. This can be tested by the simple semen analysis that can be done in a laboratory. For a woman, it could be hormonal imbalance or irregular periods, which can be diagnosed by history or by doing some blood test. It can be also a functional problem, such as blocked tube, which can be tested by an X-ray called hysterosalpingogram. That's when they inject the dye through the cervix and take an X-ray to see that the dye has gone through the tubes and show the normal tubes. If a patient has negative tests for those, usually we can try them with some medications such as Clomid to increase fertilization and increase chance of secretion of the ovaries, secretion of the eggs. Also, men have a low sperm count. Certain medication can help them. If none of them work, if they have the normal blood test and normal X-rays, next option could be something called IUI, in utero insemination. That's when they take the sperm and wash it and put it inside the uterus directly. And again, this depends on patient age and many other factors. But if the IUI doesn't work, the next step will be IVF. IVF or in vitro fertilization is also used for people who have low sperm count or blocked tube or very low egg numbers. And that's when you actually take the sperm and the egg and you cause the fertilization of the egg and make an embryo and put it inside the uterus. With IVF, you can always use somebody else's sperm or somebody else's egg if that's be an issue for the couple. And the good thing with IVF is that you can also do pre-implantation testing. So if somebody has a history of genetic anomalies, you can test the embryo before insemination and before placing it inside the uterus.